Hello, everybody. Today I want to share with you some horrifying news. For my new subscribers, I'm a senior associate scientist at a Pfizer facility in Kiev. Before, we were only tasked with important drugs in Ukraine and their distribution here. However, recently we were attached to a big project. I was recommended actually for it due to my experience in clinical trials. As far as I know, usually Pfizer trials are done in strict accordance with the international medical standards and regulations. At least in the documents that were given for me to review, all the regulations were strictly observed. However, the new COVID 19 vaccine trial that's happening right now is just a nightmare. Children are dying. Moreover, subjects aren't even aware that they're being experimented upon. This trial must be suspended immediately, but my employees refuse to send the vaccine for revision. Last November, Pfizer brought here a new test drug with the code name C6160B. It's the next generation of COVID 19 vaccine for children. Kids aged from 5 to 11 were being injected with it under the guise of flu shots. Pfizer employees are only involved in the analytical part of the trials, and shots are being administered by the local nurses in the few children's hospital in Kiev. I don't know if they are aware that they are offering parents to inject children with our new drug and not with the German equivalent of the flu shot. We have no communication with the hospitals. There's some agreement with the Ministry of Health, so we get all the data on the condition of the patients from there. They have an electronic register updated with the data from city hospitals. The first phase was completed extremely fast because the management was pleased with the results. Even then, I wasn't happy with it because the sample size was too small, which I repeatedly talked about at the meetings. Still, the results are satisfying for everybody else, so the trials went on to the second phase. And that's when the horror started. There was a huge scandal in the research department, and a couple of days after the administration of shots, patients were being hospitalized with hypertension, chest pain, and fever. There were a few cases of fainting as well. We ring the alarm on the day 4 when the first death happened. You know, a 4% rate of death rate and 20% of hospitalization rate were grim results of the vaccination. Usually, this would result in an immediate revision of the drug, but after a short investigation, everything was written off as an improper conditions for transporting the batch, and we were ordered to continue testing. This violates every regulation in existence. The Ministry of Health didn't have any objections also because the project was coordinated with our President Zelensky. As a result, the second series of shots followed the first one. 300 more children were vaccinated with almost the same result. I wrote a report demanding that the trials must be stopped immediately. And today I was told that the trials are approved to go on the third phase and the drug will be revised in the process. They say the company only has time until May, so no one is going to shift or freeze or cancel the project and the trials. I'm speechless. We started these trials to help children, not to injure them or murder them. This is a part of the trials documentation, and we can see the mortality chart. As I said before, the mortality rate is extremely high in the second phase, but the trials aren't stopping. This is a fragment of the list of children patients. Some of them are already dead. In 3 months, around 1,000 children were vaccinated in 5 different Kyiv hospitals. Right behind our office is the Institute of Cardiovascular Surgery with Children's Ward. Some children were brought there. Our experts could examine them personally. The next phase is set to begin on February 12th, and tomorrow I will once again demand the higher-ups to stop the trials. I can't just watch our country becoming the test field for illegal medical trials.